During a visit to Bothwell Regional Health Center, Governor Nixon called on legislators to reform Medicaid and stop further damage to Missouri's economy.
Across the nation, we've seen governors and legislators of both parties come together to bring their tax dollars home to improve and reform health care in their states. But here in Missouri, we stood still.
Since January 1st, 2014, Missouri taxpayers have spent $530 million to fund health care in other states.
That's $2 billion a year. That because these other states are moving forward, they are spending our dollars in those other states.
Bothwell employs more than 850 workers, making it the second largest employer in the region. But without Medicaid reform compensating for federal cuts under the Affordable Care Act, Bothwell has been forced to reduce its staff and services.
We're getting hit kind of a double whammy. We're seeing lower reimbursement in Medicare, and we haven't seen the offsetting coverage of those eligible to the 138% of the poverty level.
In March, a report from the Missouri Chamber of Commerce and the Missouri Hospital Association found that inaction on Medicaid has already cost the state more than 3,000 jobs. The report also found that half of hiring freezes have been in rural communities.
We want to make it accessible and convenient for those residents in this region. And if we have to cut back on services, it really becomes a burden on everybody.
Moving forward will allow us to make common sense reforms to promote personal responsibility and reduce costs to the state budget, generating more than $90 million in savings and revenue this year alone.
To learn more about strengthening Medicaid in Missouri, visit mo.gov.